7:30 in the morning. I just closed from work and I'm tired, I'm hungry, I'm feeling sleepy, I'm cold. But this message I'm about to share can't wait. That's why I'm making it right now. So please don't skip this message. You need to watch and share it. Let somebody hear this message. All right. And this message is directed to all healthcare workers, whether you're a doctor, a nurse, a midwife, and even patients and their relatives. You need to listen to what happened. So a friend of mine told me this thing, and it's very painful, very, very painful. What happened is that they sent their kid to the hospital. They got there around 1:30 a.m. I don't want to name the name of the hospital, but it's in the Upper East region. When they got to the OPD, the physician assistant who was supposed to be on duty was nowhere to be found. So the nurses have to go and look for him, and he was fast asleep in one of the consulting rooms. So when he came out, he appeared still sleepy and appeared visibly angry. And what he said was that how many people are in the OPD that they have to come and wake him up? You can imagine. I don't know if a hospital facility is a party ground and you are waiting for people to gather before you attend to them. And after saying that, he looked at the kid. He didn't even ask for the vital signs of the kid. It was like the kid is not even all that sick. And why are they coming at this time of the hour? Imagine, and I'm not kidding, I'm not lying. My friend, he himself is a nurse. So he's not lying. And I asked, what did you do? He said when he wanted to talk, his brother and the wife were like, they shouldn't even make him more angry. They should just keep quiet and let him attend to them. And this is what is going on. I'm not lying. I was a nurse back in Ghana. What we do is that when we come to work by 11:30 to 12 midnight, after nighttime medication, all the senior nurses, all the senior staff will disappear. They'll go and lock themselves in a room and only come around 5:30 or 6:30 in the morning. They'll hand over the ward to the junior, the newly recruited nurses, or sometimes even national service. These guys are still trying to gather experience. You have been on duty for a long time with a lot of experience, and you normally disappear. You will see nurses and midwives arranging among themselves and doing shifts like 12 nights, 2 weeks, just because when they come, they have time to sleep at work. So imagine somebody who has gone to school and studied for 4 years, 6 years, some 8 years, depending on the professor, will say this. You come to work and you are acting like you are being forced to come. You are an adult. You yourself have decided that you want to be a nurse. You went and studied. The citizens paid for your education. They are paying for your salary. And you come to work and you are behaving like you are being forced. Some of them actually act like they are doing them and their relatives a favor by coming to work. But nobody has forced you to be a nurse, a midwife, or a doctor. You understand? You yourself have decided that you want to be a health worker. Okay? There are a lot of nurses, midwives who are home. They want opportunity to be employed. So if you feel like your salary is not adequate for you, don't come and even add more stress to patients. This is the attitude we put forward, and some people will be sick and they are scared to go to hospital because they go there and what they receive is more insults, disrespect. And it's even more worse if you come and you are looking poor. Some of the nurses, especially the female nurses, when you come and you appear poor or something like that, they will talk to you anyhow. And now, I don't blame the nurses because we are not accountable to anybody. There are no consequences of such behavior. I was a nurse back in Ghana. I'm not a changed person, it's still me. But practicing nursing in the UK here, there are some things that you will not dare do because you know you are likely to go to jail or you are likely to lose your job. Ghana, it's not like that. So I'm calling on NMC, I'm calling on Ghana Medical Council. You have to start taking people keen. And the citizens as well. You need to start demanding the best from the people you employ to provide service to you. You pay for our education, you are paying for our salary. So anybody who feels that the salary is not enough, please step down and give others opportunity to serve. All right? Don't come and you are putting your anger on patients and their relatives. It's not fair. It's not fair. You are a professional who has been trained. So this thing is so annoying. This is what we do, and when we go on strike, we are wondering why the people don't support us. So please, I'm begging, if you're a nurse, if you're a midwife, if you're a doctor, please, let's change our attitude, because one day you will be the same person on the sick bed, and you think you know what to do that time. You think you can instruct them to do the right thing when you're on the sick bed. No. So let's change our attitude. I'm begging you guys. I'm begging you guys. All right. Thank you guys for listening. Share this message.